Today, we're going to talk about oral, head, and neck cancers. Head, neck, and oral cancers happen when abnormal cells begin to form in the mouth, nasal cavity, salivary glands, lips, and pharynx, which means the throat. The cavity behind your mouth and nose connect your throat to the voice box. Tumors can be primary or secondary. Primary means they originate in the head and neck, in the lymph nodes. Secondary means they start somewhere else in your body and spread to your head and neck. There are two types of head and neck and oral tumors. They originate in different areas of the body. Most of these cancers are called squamous cell carcinoma. These tumors develop flat in the squamous lining of your mouth and your nose and throat. A tumor found only in the first layer is called carcinoma in situ. If it's growing deeper into the tissue, that's when it's called invasive carcinoma. The other type is adenocarcinoma. It typically starts in the salivary glands. Cancers of the brain, eye, and esophagus, thyroid, skin of the head and neck are not usually classified as head and neck cancers. Squamous cell carcinoma of the head and neck is going to spread and almost always does so locally in the lymph nodes of the head and neck, not the rest of the body. Sometimes cancerous squamous cells can be found in the lymph nodes of the upper neck where there's no evidence of cancer in any part of the body or the head and neck, possibly because it's the primary origin of the tumor and it's still relatively small and it stays where it is. 100,000 Americans are diagnosed every year of head, neck, or mouth cancer. The most common types are oral and oropharyngeal cancer in the throat or in the head and neck. 54,000 Americans are diagnosed each year, and more than half of them are men. Most head and neck oral cancers are rare. Only about 2,000 people in the U.S. are diagnosed with sinus cancer each year, and fewer than 13,000 people in the U.S. will be diagnosed with laryngeal cancer. The incidence of most head and neck cancers have been dropping, likely because fewer people are using tobacco or smokeless tobacco, but they're increasing because of HPV in our younger population. So the risk factors are moving the people that it affects. But smoking increases the chance of getting head and neck cancer. How can you stop them? By lifestyle changes, preventing those activities. Don't smoke, don't chew tobacco, drink in moderation. That seems the easiest way to stop oral cancer. Excessive alcohol use combined with smoking increases your chances of getting head and neck cancer and throat cancer. Limiting alcohol consumption and smoking reduces your chances, right? If you have an immune system issue, it lowers your immune system and makes you more susceptible to head and neck cancers, especially if you've had a kidney liver transplant and are on immunosuppressant drugs. And HPV, the human papillomavirus and Epstein-Barr virus, also cause cancerous changes in your mouth. The HPV vaccine can significantly reduce your risk of oral cancers, including head and neck. Genetic disorders are another thing that can increase it. A certain type of anemia are things that are something that you need to look for if you have that in your body. Palmer vision syndrome is caused by nutritional deficiency and can also increase your chances of head and neck cancer. So what are the signs of head and neck cancer? Most people have no symptoms until the cancer is grown and you can see it visibly. And when you're experiencing some type of symptoms. So this is why it's important to make sure that you have these looked at. And if you have any of these symptoms, make sure you get them checked out. Finding it early gives you the best chance of treatment and survival. General signs might be a lump or sore in your mouth or your neck that doesn't heal within 2 weeks. A sore that doesn't get better in 2 weeks, make sure you get it looked out. Difficulty, pain, or swallowing. Changes in your voice or hoarseness. Blood or saliva. Blood in your saliva. Nosebleed. Hairy nose. Nasal stuffiness that doesn't clear up. Different cancers have additional symptoms. So what are the symptoms of nasal cancer? It starts in your nose. And the signs and symptoms of these can be a nasal obstruction, persistent nasal congestion, stuffy nose, chronic sinus infections that fail to respond to an antibiotic or other treatment, frequent headaches, sinus pain, swelling in your face, eyes, or ears, persistent eye watering or tearing, bulging eyes or vision loss, an altered sense of smell, cheek pain or numbness, losing teeth, a lump in your face, nose, or on the inside of your mouth, or even down your neck, or even a consistent runny nose, difficulty opening your mouth, a sore inside your mouth, on the roof of your mouth that doesn't heal or last more than 14 days. If you're starting to feel tired, unexplained weight loss, or have a lump in your leg, make sure you get these looked at. If you haven't subscribed to my channel yet, click the red button. I put out videos like this every week that talk about the health-body connection and how you can take ownership of your health. Oral cancers are a little bit different. They usually begin on the tongue or floor of your mouth, but other areas can be involved. So symptoms of these type of cancers are white lesions in your mouth, a sore that doesn't heal, problems with pain or swelling in your jaw, teeth, or even a lump in your neck. A lot of these are a combination. Salivary cancers can involve your salivary glands. Your salivary glands create saliva, moisten your food, aid in digestion. Saliva is really important. It cleans your mouth. It contains antibodies that destroy germs, prevent cavities. Symptoms of salivary cancers can include a lump in your ear, your cheek, your jaw, your lip, or on the floor of your mouth where your saliva glands are. Fluid in your ear, trouble swallowing, trouble opening, swelling, weakness, or numbness in your face. Throat cancers usually start in your throat or pharynx, and it connects to your mouth. So it connects to your voice box, your esophagus. You could have trouble breathing, speaking, swallowing, having headaches, ringing in your ears, trouble swallowing. Screening and diagnosis for these cancers are important. If you are regularly using tobacco or have HPV, make sure you get a general checkup every year by a dentist or doctor that focuses on head and neck and oral cancer. During the exam, the doctor or dentist will look up your nose, in your mouth, in your throat, feel if there's any lumps in your neck, around your lips, see if you have any bumps or have any abnormal signs. They may recommend further screening or refer you to an ENT. An ENT will use a thin tube or camera to look deeper into your nose or throat with a fiber optic so they can see what might be happening that we can't see with an oral exam. A nasopharyngeal is what it's called. Depending on what they find, they might order more tests to determine if it's cancer or if it's spread. So the other tests might include a CT scan, where they take an image of your chest, your abdomen, your head, or look at other tissues. They might look at your blood vessels. You might have an MRI, which is a magnetic resonance imaging. It's a test and it's 3D, and it can detect tumors in your head. There's a PET scan. It's radioactive glucose into your veins, and then they do an imaging to see where it goes. A lot of cancers feed on sugar, so when they put the glucose in, it will go right to where the cancer tumor is. An endoscopy is a flexible tube that can examine cavities like your ear, your nose, and your mouth without surgery. They might be able to do a biopsy where they take a small sample of the lesion, and then they have a microbiologist look at it under a microscope to see what it is. And because of HPV and it can affect your head and neck, they will screen for that virus as well. A fine needle aspiration is another thing that they can do where they stick a needle into the tumor and they suck out some of the cells, and they look at those under a microscope to see if any cancer is in those cells in that tumor before they do a biopsy. So how are head and neck cancers treated? They're usually treated with surgery, radiation, chemotherapy, and they target that specific cancer. They can use a combination of treatments. The treatment plans can be different for every individual depending on the location, the stage, the type of cancer, the person's age, and their general health. Patients and their doctors should consider treatment options carefully. They should consider each type of treatment, how it's going to affect you, how it's going to affect your looks, your talk, your breathing, your swallowing. Each of these treatments might affect your quality of life depending on the stage of the cancer. There's a fact sheet below so you can look at some of these things, but getting it checked out if you have any of these symptoms is going to be really important. Getting a head and neck screening every year. You might be having one, your dentist might even note it. The dental office that I'm at, we use an ultraviolet light in order to look in there. It's a blue light, so we can see what's in there. It's kind of noisy. It gets a little hot when it gets close to your face. There's a big fan, but when we look through this light, we can see cancers that are happening below the surface that we can't see with our own eyes. By the time they come to the surface and we can see them, they're usually in a stage 2 or 3. When we look with this light, it looks kind of dark. We can see if it's happening before it comes through the surface. We can take our finger and see if there's blood going to it or if it stays dark. If it stays dark, we're going to recommend that you have a biopsy. You see an ENT or an oral surgeon to have a biopsy, to have it removed. This is what needs to happen in order for early detection. The earlier we can detect these cancers, the earlier the survival rate, and the chances are you're not going to be disfigured because they have to cut this out. Oral cancer, head and neck cancers are something not to be taken lightly because we don't find them till a later stage. By the time we see them, most of these patients don't live beyond 5 years. So especially if they need some type of reconstruction, it's important that we catch this early. They generally stay where they are, but they are cancers that create some type of disfigurement. And so they change a person's life. So you can see why early detection is key to oral head and neck cancers. So make sure that when you go to the dentist, you ask them if they're doing an oral cancer screening, what they're looking for, are they checking? Don't say no to an oral cancer screen. They may just do a visual exam and not do the light. But make sure that you see your doctor or you do it yourself. It's really important that you take ownership of your health, especially when it comes to oral cancer. Ask questions. Don't be afraid to ask your professional what's going on and follow your gut. Your gut is never wrong. If you have that little thing, ask questions, follow your gut. That's how I found my cancer. When I went to the doctor, they did blood work. They told me everything was fine. I was tired. My hair was falling out. It was just because I was stressed. And that I had a vitamin B deficiency. And I was like, okay. Then my gums started bleeding. Turns out I had cancer. I followed my instinct because I listened to the warning signs. I listened to my mouth. But it wasn't until I got bleeding gums that I started paying attention. So I started looking around. And when I started looking around, I found this thing on my boob. And I'm like, I don't remember that. That's when I saw my gynecologist. And he said, you need to go for a mammogram. But I didn't start looking at all this until my gums started bleeding. And I knew that my gums were healthy. And I knew that bleeding gums were not normal. And this is why I talk about this stuff. Follow the signs, follow your gut instinct. In this case, I just happened to be right and I caught it early. I didn't need radiation or chemotherapy. Oral cancer especially is going to be important that we diagnose it earlier. Follow your gut. Be your own advocate. Take ownership of your health. Do your self-exams, whether they're breast, mouth, your whole body. Look inside your mouth with a light. See if there's anything that looks unusual, suspicious. If you have white lesions, wet lesions, sores that aren't healing, it's really, really important. You only get one body. You care about yourself. We only get one life. Make sure you put yourself first. Self-care so you can be there for your family and live a long, healthy life. Everything starts in the mouth. At least from my perspective, we put everything in our mouth. That's where we should start looking. A healthy mouth is a healthy body and a happy, healthy life. If this was helpful, please share. Until next time.